Welcome back guys to my YouTube channel. My name is Nas Dennis. Kindly support me by subscribing to my channel. Today I want to talk about 9 warning signs of hypertension or high blood pressure. Remember that high blood pressure is one of the major leading causes of premature death worldwide. Currently 1.28 billion of adults between age of 30 and 79 have higher blood pressure and is more in low and middle income countries. 46% of adults with this condition do not know. That's why it's always said that high blood pressure is silent killer. Your life or health can suddenly change and you are not aware that you are sick before. That is the reason why we always advocate that you regularly check your pressures, because even if you don't have the symptoms, it can still cause damage to your body organs. Remember, it causes risk to so many illnesses like kidney problems, heart problems. It can also cause stroke. So those are one of the world leading causes of death, and it's very important to regularly see your doctor or visit the nearest clinic to check your blood pressures. So blood pressure is the force that blood exerts on the walls of the arteries. It's normally measured into two different ways. We have systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the pressure in the arteries when the heart contracts, while diastolic blood pressure is the pressure in the vessels when the heart relaxes. So you normally see one over the other. The upper one is the systolic blood pressure, while the lower one is the diastolic blood pressure. If you have high blood pressure, it means you have blood pressure above the normals. So what is the normal blood pressure ranges? Normal blood pressure, we must understand the normal systolic blood pressure and the normal diastolic blood pressure. So the normal ranges of systolic blood pressure is between 100 and 120. While diastolic blood pressure ranges between 60 and 80. That is the normal. So if it is above that, you will either have elevated blood pressure due to physiological changes in the body, or you can be having high blood pressure. So blood pressure are into stages. If you have systolic blood pressure between 120 and 130, remember that the normal is below 120. So if it is between 120 and 130, that is elevated blood pressure. So stage 1 of high blood pressure, the systolic blood pressure is between 130 and 140. And diastolic blood pressure is between 80 and 89. Stage 2, systolic blood pressure equals or is greater than 140, while diastolic blood pressure is equal or greater than 90. So if you have blood pressures of around 180 over 120, that is known as hypertensive crisis. So at that point, you are in a very critical need of medical attention to prevent further damage of your body organs. So how will you feel when you have high blood pressure? So these are some of the signs that you are likely to observe in your body or in your cells. The first one is headache. If you have high blood pressure, you are more likely to experience headache because of the increased pressure in your brain. Secondly, you will have blurry vision. You will lack clarity of your vision. How does hypertension causes blurry vision? Remember, in your eyes, there is that part called retina. And the retina it is made up of small blood vessels. So when you have high blood pressure, they can easily rupture and have what is known as hemorrhagic retinopathy. So they will cause bleeding in your eye. Secondly, the blood flow to the retina can be compromised. That can also cause blurry vision. And thirdly, you can also have increased pressure in your eyes, what is known as intraocular pressure. When you have that, you will not have clarity of your vision. Thirdly, we have weakness. You can experience weakness. Sometimes it can be a focal weakness. Hypertension is one of the leading causes of stroke. So it can cause paralysis in your body, because I've said the damages of various body organs, including your brain. When you experience sudden weakness in certain part of your body, one of the causes can easily be hypertension. So don't take it lightly. If you see someone having weakness inside of the body, can be weakness of the face, the left side or the right side. That one can indicate high blood pressure. My next point is chest pain. Hypertension can cause heart attack. Remember, when you are hypertensive, there can be compromised blood flow to the coronary arteries. So this one will cause ischemia. And one of the symptoms of ischemia or ischemic heart attack is chest pain. So you'll suddenly experience chest pain, or what is commonly known as angina. So if you have a sudden feeling of chest pain, that one can indicate various problems. Heart attack, which can be because of hypertension. My next point is fatigue or confusion. So when you have hypertension, your heart is compromised. The major function of the heart is to pump blood to the rest of the body and organs. So when your heart and lungs are compromised, it means that the blood flow to body organs and even oxygen is compromised. So that one will bring fatigue. It can also affect your brain. Remember, any moment your brain is limited of oxygen, you will present with confusion. So your neurological part of the body is affected. So you'll probably present with confusion and also fatigue in general. So if you are fatigued and you are hypertensive, or even if you are not hypertensive, you can always go to your hospital and check your blood pressures. And if you are hypertensive, the health education we give you so that you know when your blood pressures are elevated or not. My sixth point is nausea and vomiting. What causes nausea and vomiting in hypertension? One of them is increased intracranial pressure. So when your intracranial pressure increases, one of the things you'll experience is nausea and vomiting. Can also be hemorrhagic stroke. When you develop hemorrhagic stroke due to hypertension, you will also experience this. And lastly, can also be due to heart attack. One of the major symptoms of heart attack is nausea and vomiting. My seventh point is shortness of breath. Shortness of breath can be due to heart attack. It can also be due to other complications known as pulmonary edema. Your lungs are filled with fluid, and due to heart failure. Heart failure causes inadequate pumping of blood. So that one, you will have fluid retention in your lungs. That is pulmonary edema. When you have all these factors, you will exhibit shortness of breath. Eighth point is nose bleeding. In your nasal cavity, there are tiny blood vessels, and high blood pressure can cause rupture of these blood vessels. So you can experience nose bleeding as a result of hypertension. My last point is back pain. Hypertension can lead to aortic dissection. At this point, your aorta can be compromised, leading into bleeding into the walls of the aorta. One of the major signs of aortic dissection is back pain. So all these can be as a result of hypertension. And remember, when I started, I said 46% of individuals do not know they have this. So it is a silent killer. They have no symptom. It is very important for these individuals, or for everybody, to do regularly to check their high blood pressures. I hope you get something from this tutorial so that you help save a life. You engage in activities that will help you reduce chances of having hypertension. Thank you for watching my video. Kindly subscribe to my channel and leave a comment down below. Give me a like and share me out, guys, to your friends. Thank you.